was such a privilege to have you here. Thank you so much for that wonderful keynote speech. So moving on, it is my pleasure to introduce someone whose work is changing lives across the MENA region. This woman is not just a powerhouse, she is a leader in the field of sexual and reproductive health, right? She's a true champion for girls and women everywhere. For over 10 years, she's been pushing boundaries. She's been advocating for policy changes, just like Dr. Chidibe recommended, and she has been creating opportunities where they are needed the most. Her name is Dr. Nohan Bada, and her work isn't just expiring because it's research and, she's a physician. She's committed to what she's doing. She's very intentional about making sure that every woman and every single girl has the resources and knowledge to take control of their health. This is so important for the economy. So I would like you all to give a very warm virtual welcome to Dr. Nohan Bada. Please let's welcome her in the comment section. Welcome, Dr. Nohan.
Hi, everyone. Hi. Thank you for the invitation and the reach out and to join this webinar. It's close to my heart. The topic is very close. And I'm also really excited about the Trans-African dialogue. That's something that we don't do usually. And the regions of Africa usually talk to each other, the East Africa, North Africa, and West Africa. So I'm really happy to bridge this gap and listen also to what are the issues in the other part of Africa. And I know very well how MENA region is not North Africa, especially is not well connected to Africa. So I'm happy that I'm going to share with you the barrier and challenges that we have in my region, but also listen. So I'm excited to be here, and I'm saying hi to all Kenyan and Nigerian taking over this space as always. The most attendees usually comes from both countries. So hi everyone. I work in SRHR for so long in Egypt mainly, but also in the MENA region. What's interesting in North Africa is the language. Arabic language is connecting this region in a way or another, which is different than the dynamics in other parts of Africa, where you find a lot of tribal languages. Of course, we have our own dialect, and the mix in of English or French depend on the decolonial power that we had in the region. But the Arabic language kind of connected this region, which is very important when we talk about menstrual health in terms of the intervention that you can do digitally that can connect this kind of providing information and knowledge. And that's something that I already do. I lead a project called Love Matters Arabic, which is a digital platform about sex and relationship that provide information for young people in the region. In Arabic, we have different platforms. We have a website, all kind of social media, Facebook, Instagram, but also we provide counseling. We provide information and answering for free through the platform. And one of the topics that we tackle always is menstrual health, and menstrual health also management, which is a new term that coined in the language of the scape, but it was like you feel management is very businessese. I'd like to you, it's a health, it's well-being, and management seems so serious as if we don't know how to deal with this thing, which is always interesting how women issues is addressed in this region. So the region lack, and generally speaking, we don't have comprehensive sexuality education like many countries in Africa region, which is a very key to provide information. It's very sustainable intervention. It's age appropriate. I cannot talk about CSE. Everyone knows what it's supposed to be. So since this, we provide an alternative through Love Matter Arabic to provide this kind of information in Arabic. But also at the end of the day, it's a very I don't want to say elite conversation, but it reaches to people who have access to internet, who can read, who can have a smartphone, which is not everyone in Egypt or everyone in the region. So it's an alternative, but it's not the ultimate solution, right? It's a way to close the gap when we talk about menstrual health. And then another term that has been coined in the menstrual health is a period poverty. And when we talk about the period poverty, we talk about lack of information that I already spoke about, but also with the lack of the information, you find a lot of misconception and a lot of and I guess it was 5, 6 years ago, I was interested to know the myths in Africa and myths in my region, from not showering during the period, or not coming close to a farm or harvest, or not allowing her to cook, or so. I did an article about this kind of myths, and it's a lot of myths, and it's burdened by the shame and burdened by the lack of information about, like, women having menstrual or having a period. It means that they are not supposed to practice a lot of activity, from cooking, being in a farm, going to school sometimes, and sometimes playing sport, eating certain type of food. So a lot of restrictions comes at the very young age. Women usually experience, and they depend on the demographic, from 9 to 10 years. So it's a very restrictive, and it affects, yes, the mental health, as the speaker was mentioning, how also a young girl at 9 or 10 years have this kind of limitation once she starts to experience a normal cycle, a normal physiological change as part of her growing up. So it turned out that out of sudden she has to stay away from boys, does not participate in the sport, had a lot of social restriction in this, and it affect how she's going to grow, and it start to also have this kind of shame. Shame is transformative, right? She experienced something, and instead to have a lot of negative information. And I did a study about mother-daughter communication about puberty in Egypt, and I find it really interesting. Most of mothers want to convey health messages, but most of them, they don't have the skills, and they don't know how to start this conversation. And also they are afraid from the information, and this is something that we find it in sexual and reproductive health. Everyone fear, like, if I provided information, they're going to do something with it, which means that we need a lot of working in a social norm. So very poverty, lack of information, but also you find also lack of product, the period products where we can manage this period. The product is limited, the option is limited, and in Egypt we have not necessarily a good quality product, which is the product is very easy to use, some cotton, some plastic, but still there is no investment in it. And when you when you find it in other cosmetic areas that is directed to women, you find period products are the less studied and the less developed. You find thousands, millions of products for face and skincare, but then this specific item, you don't see multiple option. You don't find it a lot of option. And we have started to have certain product that is more sustainable, that work with that avoid better for the climate and better for the environment, like the cups. But also we have issues related to virginity. So that's why lack of information and social norm is really important to work with, to have this kind of product. And in Egypt specifically, we have a luxury product. We consider period products as a luxury. So we have an extra taxation on it. So we have the VAT taxation, the 14% taxation, but also it had an extra taxation because we find it why women want to do this, so we add extra. So it's in the same category of nuts and same categories of cosmetic, so it's more expensive nowadays. So it's really expensive to buy those products. And I did a lot of interviews with women to understand how the pricing of such important and key product that she use every month is affecting people's life. And I heard from girls saying, like, I count how many pads that I have, and I decide how many time I'm going to change, which is affect her reproductive health, fertility, future opportunities of having a good health, because she cannot afford it. When you ask if you need to, like, she has to change every 6 hours, she say, no, I have only 4 or 5, so I'm counting this on the number of days that I'm going to have the period. I find it also with people who have resources. She said, like, I have 2 products. One is cheap, one is expensive. When I'm staying home, I'm using the cheap one. When I'm going out, I'm using the expensive one. So I don't want to talk more about period poverty in terms of how affordable management tools are not available to women. And you can see it across not only Africa, but also across Europe, we are facing inflation. In Egypt specifically, you have also devaluation of currency, so becoming more and more expensive for women to buy. And I can imagine if a family of a four and have a wife and have two kids, two girls that are menstruating, what are the choices and how they're going to navigate this to buy such a product. And then after this, we can speak about the wash, the availability of water and sanitation and privacy to women to use it. And access to water is a very problematic in rural areas, but also it's very problematic in the school. And we find many schools that has closed bathroom, even for boys, not only for girls, but that does not have a clean bathroom, that have water, that have a look, so she can change her period product. So wash intervention is also one of the barriers, and not only in the school, women in workplaces. I'm currently, which is interesting that we're having this conversation, I'm currently working on a policy brief about menstrual health in Egypt, and I was talking to women in workplace, and even women in workplace, especially in public sectors, they find the challenges having a clean bathroom that have access to water, so she can change. So we ask women as part of gender equality to be part of economic empowerment, and she be part of the economic and being productive, but we don't see what is the needs of this woman to participate actively in the economy, right? So like we deal with her as a machine. You put it here, she's going to work, but we don't consider the other factors and the adaptation. And one key that was not only surprisingly, but is really challenging women with disabilities. Motor disability, mental disabilities, also blind, deaf, they don't receive any information, but also they need a certain adaptation in the classroom. They need certain products. Most of them, they don't use regular menstrual product. They use the products for kids, for example, that can use it because they can control the movement, right? If you have a motor disability, is really problematic for you. So when we talk about access to information, we wanted to have access information inclusive, also access to information. So we consider everyone. We don't want to leave most of women and girls is disability where they suffer the most, even with the and what are also kind of intervention that we want to make it available. For example, we educate women about the color of the blood and how it's going to change, what could means in terms of like possible infection or anything. What does this mean for a girl that she's blind, for example? If there is a way that we can teach her, is the smell, or what kind of intervention? We need to think about all of this ways to include women and young girls in this conversation. So even women in workplaces, they also suffer, which is both affect their participation in the economy and mean more absence, and mean that you are worried, stressed 100%. Even most of young girls and women here, before their period, they experience at this level of stress. When it's just going, should I have an extra bed? What going to happen? It's already extra mental burden in back of our heads, whatever we acknowledge it or not. So imagine having to go to school, or imagine having to go to work place where you find it's really more stressful. So we find, and it's well documented in the evidence, the number of days that girls drop school or being absent, and how this affect the education attainment for those girls, and how future going to affect her future engagement. And one of, as a physician also, there is an interesting book called The Invisible Woman, and it talks about the lack of data related to women. And you find it, it's really interesting, the menstrual irregularity. When we talk about menstrual health, we don't also talk about like normal period, but also we have to talk about BMS and disorders related to severe pain, and how going to shape, because also surrounded a lot of social norm that women around this cycle is crazy. They they cannot make an informed decision, which affect our women participation, especially in the political scene, right? So we find that it's not studied enough. The treatment is not studied, not only PCO, also endometriosis, post-traumatic, premenstrual syndrome, premenstrual disorder. It's very severe. There is almost 20% of women are experiencing this. They should not be experiencing this. And there is a small amount, like the diagnoses are not well developed. Healthcare workers are not oriented by these cases. Women, some goes multiple times. BCO, for example, and endometriosis, woman has to experience at least from 3 to 4 visits to be rightly diagnosed. And also because usually they ignore women pain, right? That's the nutshell of it. You go, even if you have a menstrual pain, it's like, oh, your mom suffered from this, or the doctor is like, it's normal period, and then you pass, right? So you should not have a severe pain during your period. It's not normal. So even those menstrual irregularities are not there. And then finally, if I want to speak about menopause, it's part of menstrual health also. Women who are going through menopause, we need to talk to educate them and provide the information how we can gracefully go through this phase, especially that also with this urbanization and change of the environment, we find more young girls in the 35s and 40s going through early menopause, right? Or pre-menopausal. What does this mean? How can I move gracefully in this phase? What kind of supported treatment that I need to take? And instead of all shame about menopause, right? Because it's well praised in our countries that menstrual cycle or period mean fertility for women, right? Everyone is happy when you get it, but everyone is sad and shame you as if this is the end of your life, right? It's women are really tied to their fertility, which is very problematic also. So also we need to talk about menopause and give more information and more access to healthcare, and also think about the treatment. If you go to any website in English, you find very limited option about what are my options to move through menopause. And finally, because I'm thinking a lot about my region, now we have what's happening in Gaza, what's happening in Palestine, what's happening in Lebanon, what's happening in Sudan. Also, we find also women in humanitarian crisis. Usually, we provide them food, and we forget about that they do have cycle, and they're going to have cycle even in the midst of war and conflict. So, what it means also from humanitarian crisis intervention to deal with such topic, what it means to consider. To consider access to menstrual health product that is usually not provided in those packages. Recently, we find UNFPA, we find many UN agencies started, but also, I mean, in the local context, right? When we are the host country, for example, Egypt, how we can make it more affordable for women in this phase to have access to these products. So, and finally, mental health and well-being through this, you need to, women doesn't like, if you interviews women asking them about their first period, their experience will be that I was scared, I was crying, I was surprised, I got it in the school and I was embarrassed. This should not be the case, right? It should not be. When, like, girls need to be prepared by what going to happen to them, what kind of menstrual stuff that they need to have, so they can go gracefully through this phase and avoid all this cycle of shame and having a really affect how we see our body and how we interact with our bodies. So yeah, that's what I was having in my mind, that the issue that intersect with menstrual health and how menstrual health is dealt with in my region, but also in many regions. And I'm surprised that we having this conversation. Women have been here since the beginning, and I don't know why we still are discussing the most basic right in a normal change, but we have so much investment in fertility and contraception and infertility in comparison. So I guess because how it's seen, it's we see it as a process, not a outcome, right? We see fertility as an outcome. That's why we invest in the outcomes more. So experiences of women is usually not well studied. So yeah, it's interesting that we are having this conversation and still having it. And I, unlike many countries in Africa, I see a lot of progress in Rwanda and Kenya, for example, of removing VAT or providing it in the school, for example, which is something that I'm bringing to my own country right here in African context. And that's why the beauty of the Trans Africa communication, we need to bring the experience, because they feel like, oh, maybe this is happening in Canada. No, it's happening here in countries in like Kenya and Rwanda. They are doing this. We can also move forward and try to, like, we need to do this the same in our country and learn from each other instead of learn. We find it's really interesting. We learn from each other when it's bad, right? Sometimes with the anti-FGM in Gambia, we find it's tackled down to other African countries, but also we need to leverage this. So most of the time when we use our advocacy, we focus on country that is upper middle class or high income. Sometimes it bring the conversation with policymaker. I was like, oh, no, this is far away from us. So it's really important also when we leverage messages that we take example and case studies from our own region to say, like, here, there is other countries in our region with similar context, with similar challenges and economic status that done this, so we can push our messages forward. I guess that's what I have on my mind. Maybe when we come to Q&A, or you can reach me after the webinar and have this discussion. So thank you so much.
Thank you so much, Dr. Nohan. Thank you so much for that impactful session. It was so beautiful. It was so amazing. You know, I loved how you emphasized how menopause is also very important. You know, we don't often hear that in menstruation conferences or, you know, talks about menstruation, about how menopausal knowledge is very, very important. You also talked about how, you know, as a region, we also have to emphasize our countries, right? Other countries in the region, and look for how to empower them to get to the same level that we are in. There was something you made mention of about how we don't have enough research, which I totally agree with. People just normalize menstrual pain. Oh, that's how it ought to be. You could literally see a young girl rolling on the floor because of menstrual pain, and it would be so normalized in, you know, medical institutions, and they would just prescribe a medication. There is no research. Oh, how often does this happen? How often does it happen? Something that we honestly have to look into. You also made mention of women with disabilities, and I'm so glad you made mention of this. It's also important, you know, people with disabilities are also relevant. Every single type of man is a human being. So we also, there has to be varieties of pads. You said that use what little children use, because, you know, pad companies are not really putting their eye and their focus on this type of women, and they are also equally important. So it's something we also have to look into. How do we have these pad companies make a huge variety of pads based off women that don't have disabilities, and those that have certain disabilities? They are so important because they are also important in empowering the nation and empowering the economy of every single nation. So I'm so glad that you made this, you know, this known to us, and you just renewed our minds and helped us to understand how important it is to include every single woman, because every single woman matters. This is so important. Thank you so much, Dr. Nohan Bada. So this is an open room for our audience and for our attendees. If you have questions for Dr. Nohan Bada based on her presentation, please, the room is open. You can ask your questions. You know, if you have contributions about what she has said, if you have questions about what she has said in particular, now would be the good time to ask, and you would have to use the comment section below. All right. So I'll just give us a few minutes as we type in our questions, below for Dr. Nohan Bada. Just a few minutes to ask our questions. Okay, so we have one question here from Tinu Adeyonju. I'm sorry, I hope I pronounced that right. Tinu Adeyonju. His question to you, Dr. Nohan Bada, is what is the nexus between menstrual health and mental well-being? What Yes.
I guess when we see the new definition of WHO of health, right? We see that health is not only the physical, but also the social and mental well-being. So I guess it intersects. It's so much stress since the beginning of 9, 10 year old having to experience this level of stress and mental health in Africa. And I know very well, like it's a shameful conversation, but also you experience a lot of stress and we normalize this stress, right? We normalize the stress before the period. We normalize, and also we put a lot of burden on us. Um, you have to hide sometimes that you are in pain. You have to hide that you have your period. You are not allowed, you feel shame to say in a workplace, like, I don't feel well because I have a period. So all this kind of shame and burden that we carry on, it affect our mental health, but also we find that in puberty a lot of anxiety and a lot of mental health issues rise at the beginning of this age, and it's really critical to diagnosis. And we know very well that it was well diagnosed, the treatment likely to success. So you add an extra layer of girls having this stress around the period, so it makes it really hard for them to navigate well and also focus on their study or focus on anything that they can do. But also it's really hard to say like I'm in pain, right? Even at this age, like it find it's like sometimes when I be in workplace, I was like, you know what, I have my period, I cannot focus enough. It does not mean that I don't have any agency or me or think well. So yeah, I guess there is a huge intersection between menstrual health and health in general. Like I cannot separate the physical well-being from mental well-being, and how also community and society affect you. And I wanted to add also for my conversation is private sector. We find a lot of femtech, and I know that maybe also we have here among the speakers. It's and especially in a lot of I know in Kenya and I know in Rwanda there is a lot of intervention for female femtech and providing menstrual health product that is more reusable or sustainable, but also big corporate, like we don't pressure them enough. It's same like pharmaceutical company. The whole advertising in ad that berry blood is blue. I was like, what's happening? Uh, it's so much that you are be younger and started to like you feel like I'm going to bleed in blue. So what is this role? What is their role in advertising their product? But also they can be endorsed to have a right health message or appropriate health message during this whole conversation. Like my life does not change from being sitting in the bed and being painful, and then I use the product and all of a sudden it's happy and growlers and I can practice my life. So also what kind of information these young girls take early from this little advertising in the social media or in TV, and how it affect our own expectation of our bodies. So one of the things that I was thinking about how is how we can also pressure private sectors um, to to um, to advertise, have a right message. And this is something that one of the recommendations that I'm going to write in a policy brief that I'm writing right now. Yeah.
Thank you so much. Thank you so much, Dr. No. Okay, so there are more questions coming in. All right, so we'll just go straight to the next question because we only have 10 minutes. So Blessing is asking, has the effect of high taxes of menstrual products been brought to the attention of those in power in the MENA region? Dr. Nohan, this question is for you. Has the effect of high taxes of menstrual products been brought to the attention of those in power in the MENA region?
Specifically now in Egypt, Lebanon both faced a huge inflation. Other countries that is low income, especially I'm talking about North Africa. The Gulf area is already rich and they already have resources, but I'm talking about those country. Usually the conversation is among women right organization and feminist organization. They do campaigning, they talk about it, but the connection between policymakers and menstrual and those organizations are not leveraged right now. And because also how we see this topic, it's not a priority, right? Like you should wait, like we have a crisis, like Egypt now in a current huge financial debt. You can read about it everywhere. So we have a lot of economic debt. So they feel like it's not a
They
priority.
feel
And
like
it's amazing how
yeah,
sometimes,
amazing how sometimes
sorry, I'm hearing a little bit of echo.
the people.
Please, if you're in the meeting, please mute your mics. This is very important. As you tune in, mute your mics. Dr. Nohan, you can continue. I don't think there's
Yeah,
any.
so I guess we need to work on bridging this gap between policymakers and feminist organization or women-led organization to have this conversation and press, but because also we don't have enough research about the economic loss from menstrual health being not so good, right? Because missed school days can be numbered in the economy. Not going to the work because of your period can affect the productivity and can be numbered. And unfortunately, in many of our country, that's the conversation. It's not a right-based conversation. It's an economy-driven conversation. So maybe also one of the things that we need to have an advocacy-wise leverage different argument, every argument that talks about rights, and it has to be there because it's a human right, but also leverage economic argument and leverage other arguments. And nowadays, for example, the climate justice, for example, and the climate change, there is a lot of fund coming in. It's a new orange nowadays in the regions. We find how we can intersect and see what is the climate change affect women, and women going to be the most vulnerables, that going to be, they will not be able to move. Most of women, most of them are live around areas that is already vulnerable to climate change, and most of them work in industry that is informal sectors, that in agriculture, in situation that put them in the risk. So how we can integrate, if we are going to have, for example, funding for a climate resilience, how we can integrate menstrual health in it, right? How we can, when we talk about fertility, we talk about menstrual health. For example, in Egypt, the age of 9 or 10, when we talk about menstrual health, once the girl gets a period, she can be going to two harmful practice, FGM, female genital mutilation, because once we see that she had this period, she suffer from female genital mutilation, or she can be a child bride, right? Which is happening everywhere in Africa. So around the menstrual age and around this age of puberty, you can leverage intervention, and instead of only talking to parent about like female genital mutilation, we never talked about menstrual health around female menstrual FGM. We never talked about menstrual health around this. And usually when parents see that she got her period, they know that she grown, now she can get married. We don't have this conversation about the relationship between marriageability and menstrual health, because having a menstrual health for the first time does not mean that your body is ready for marriage or your body is ready to be pregnant, right? And this also, it's really important to be context informed about what kind of a change that happened around this age, and socially adapted to have a message. So intervention that we spend millions to do, and we have enough funding, how we can make this conversation more comprehensive and integrate menstrual health issues in issues that is already well funded. We don't need to have another vertical program that talks specifically about menstrual health. So we need to integrate it. And recently I developed a manual about menstrual health in Arabic for UNFPA, and now they are using, I have a 3-day training, but also 1-day training. So they integrated when they talk about gender-based violence, when they talk about FGM or child marriage, or have a reproductive health training. So it's really important to integrate this conversation in other intervention, and I see it might be a solution.
Thank you so much, Dr. Nohan. Thank you so much. This was honestly so profound. I hope we're able to get our questions answered. Blessing has signified that her question was answered. Tinwadi, thank you so much, Dr. Nohan. Not only did you answer these questions, but you helped to shed more light on other issues that are in relation to the questions that were asked. Thank you so much, Dr. Nohan. It was such a profound and impactful session that you had given us. So the keynote speech, if you remember from this morning, was from Dr. Chidube Mani, emphasized how we have to come together, as a community of women and men to make sure that menstrual hygiene management is properly, we're properly educated young people about menstrual hygiene management. So, one of the solutions to this is, impact, social media impact, making movies, getting the word out. Because like Dr. Nohan said, she said that there are some advertisements on menstrual pads that they use blue, illustrations of blood. And we know that blood is red. And we know that children have a certain psychology. They are what they take in. So if they've taken in a certain information that their period is a certain color, and then their first menstruation, they see red, it's going to affect their mental health. It's going to be so disorienting. So that's something that we have to change in social media. We have to change it in different types of media that we decide to go into, which brings us to our next speaker, our next panelist, who is someone that has truly embraced the power of storytelling. This speaker has embraced the power of storytelling to spark change, and he has a deep passion for African history and public health. His name is Sochima Okafor, Mr. Sochima Okafor, and his work explores the intersections between media and the real challenges faced by women and girls, especially when it comes to health. So like we said, we have to make other solutions, and Sochima is doing just exactly that. He's the founder of Film Lanes Network. He's making a lot of things in terms of menstrual hygiene. He's currently making a movie which is titled A Stain of Red, right? He's someone that knows the importance of entertainment and how this can change narratives. This can change false narratives, because in order for us to make sustainable impact in menstrual hygiene management, we have to be ready to learn and unlearn. So he's intentional about changing perspectives of people, he's intentional about making people learn what menstrual hygiene is actually all about. So every single person in the comment section and in this meeting today, please give a virtual warm welcome to Sochima Okafor. We are so delighted to have you here. Thank you so much for tuning in. We can't wait for you to share more insights on this topic. Thank you.
Thank you so much. Can you hear me? You can hear me, right? Please, I would like to share my screen. I would like to share my screen, please, before I go ahead with my presentation. Please, can the host allow me to share my screen, please?
Yes, please.
Okay.
Listen.
Okay. Okay. Can you see that? Can you see my screen?
We can.
Okay. Hello, everyone. Good morning, good afternoon, good evening, depending on where you're joining from. My name is Sochima Okafor. As Beta has already introduced me, I'm a graduate student in the United States at the University of Mississippi, and I am studying history. I am interested in history of media and public health, otherwise known as film historian. And I'm interested in using the power of media and storytelling to addressing African health issues or confronting health challenges in Africa and beyond. And which is why I am here today. And I'm very excited when I was very excited when Bluzo reached out to me, and she was like, "Oh, we are having something like this, and seeing what you do, we find it, we see it's very pertinent you join us in this conversation." And then, of course, I was like, "Oh, this is amazing. I mean, why not?" So because menstrual health is not just a Nigerian problem, it is a global issue. It is something that we can't keep silent over it anymore. And I'm a strong advocate of storytelling. I love stories so much because I know that through story we connect, we share our experiences with one another, and we find support. And which is why today I'm going to be talking about the power of storytelling and media. So before I start, I would like to I have a short story here. Imagine being a young girl in rural Africa, sitting in class one day and suddenly realizing that your period has started. You don't have a sanitary pad. You don't have a change of clothes, and no one has ever explained what is happening to your body. Embarrassed and confused, you leave school, and for the next few days, you stay home, missing vital lessons. all because of something as natural as menstruation. This is the reality for millions of young girls across Africa. According to UNICEF, 1 in 10 girls misses school during their menstrual cycle due to lack of access to menstrual products or clean facilities. The impact goes beyond education. It affects their confidence, their health, and their prospects. But what if we could change that narrative? What if we could use the power of storytelling and media to address these menstrual challenges? Storytelling, my love for storytelling is because it's not just all about, bringing people together to tell a story and then we entertain ourselves. It's the story that we are passing on. Why? What is the message that we are trying to pass? When she was introducing me, she said, I just concluded a movie, and forgive me, I might have some text, some pictures on this my presentation, and these are direct pictures from the movie I just finished producing, which is A Stain of Red. And I would have loved for this for A Stain of Red to have been screened, but because of some challenges, I decided to bring some pictures from the film so it will help me kind of communicate what I'm trying to say. Menstrual health remains a challenge for millions of African girls and women. I've already stated that statistics from the UNICEF says that 1 in 10 girls in Africa miss school during their menstrual cycle due to lack of access to sanitary products and facilities. And this absence affects their education, self-esteem, and future opportunities. The stigma surrounding menstruation makes it even harder for girls to manage their period with dignity. Because when we hear stories about menstruation, and when we hear, when young girls come together to talk about menstruation, there is usually this stigma that is attached to it. It feels as if it is a taboo. It feels as if this is something that it shouldn't be heard of. No one should talk about it. But is that really the case? How do we begin to tell these stories? How do we begin to change the narrative of what people know about menstruation? And how do we begin to make people to understand that this is not a taboo, and it is not a woman's fault to be menstruating. It is not a crime for a young girl or for a girl child to be menstruating on a monthly basis. This is a natural phenomenon. And this is the reason it is very important we begin to find ways to retell these stories or to change this narrative about the importance of menstrual health and what menstruation is all about. I have here that menstrual health challenges are not just about hygiene, but equality, education, and opportunity, which our keynote speaker also pointed out. Now, going forward to storytelling, why does storytelling matter, and what is storytelling? Storytelling is the act of using words, images, or other creative methods to share experiences, ideas, and narratives. It involves conveying real or fictional events in a structured and engaging way that connects with the audience emotionally, culturally, and intellectually. Through storytelling, information is passed on and made relatable and memorable. So I have a picture here because this is, of course, I'm a student in the United States, but over the summer, I was in Nigeria where I gathered some group of young girls, and, we wanted to tell this story. I wanted to tell the menstrual story from the grassroots level. I wanted to know what it means for young girls out there, what is the challenges. And what struck me is they were very interested. Many of them were like, for the first time someone is about to tell our story. For the first time, we feel like the story, they're bringing it down to us to say, for us to, say, to discuss how we feel. Then I remember interviewing some of them, and what they kept on telling me while I was in Nigeria is, are you going to bring the government to help us? Are you going to bring philanthropists or NGOs to help us? What is this film? What is your purpose for making this film? In as much as we are very interested in making this film, we are also interested in knowing the changes that this film is going to bring, and why are you using film or even the media to kind of foster this change? Now, the importance of storytelling in public health and menstrual health advocacy. When we talk about storytelling, or why I'm interested in storytelling, is that it creates emotional connection. Storytelling allows the audience to empathize with individuals facing menstrual health challenges. By sharing personal narratives, storytellers foster emotional bonds that makes the topic more relatable and impactful. of course, encouraging a deeper understanding of the experiences of those affected. Sometimes when people go through challenges and you think you are alone, it becomes overwhelming. But when you know that what you are going through is not, you're not alone. This is what many people out there are also going through. People are passing through a lot of these challenges. You're not alone. And, there is this connectivity, or there is this emotional connection that storytelling, it's great. And when you find like minds, or when you find people who also share the same pain with you, or the same joy, or whatever it is, it helps to foster this grace bond, and it helps to drive change. Storytelling also increases understanding and also increases retention. Stories about menstrual health challenges are more memorable than statistics alone. I mean, I would have come here to give us statistics about UNICEF or WHO or whatever it is, but that alone is not enough. Over the years, we've seen statistics. Yes, we have 800 million girls menstruating every day. A woman, on an average, a woman is meant to menstruate 400 to 450 times in a year, in her lifetime, sorry. But when we tell stories about this, or when we utilize the media to tell the stories about this, it helps people to understand what people truly go through. Because the truth is that there are some people who live outside Africa who do not really know what these people in this part of the world are experiencing. And which is why I'm very, very happy about what the Buluzo Foundation is doing, because it is time for us to begin to tell story, not just to tell story for storytelling's sake, but to tell story that would reflect our authenticity, story that will reflect who we are, our culture, that will represent ourselves, rather than telling it from the elite level, or from a kind of an environment that is outside what we know. Storytelling breaks down barriers and taboos. Like in the film I just finished making, A Stain of Red, which I have a picture from here, a mother, because everything I have in the film is based on what the interview I collected. A mother gave her child clothes, because I was looking at how are these girls being taken care of when they are menstruating? What kind of information do they have? Are they prepared before this age? At what age is it important for women or for mothers to begin to communicate or begin to tell their daughters about this? And in the case of Onome in A Stain of Red, she never had any idea about menstruation until it happened. And when it happened, when her mom saw her, the first thing she did was she was tying a wrapper, and what she did was to tear a cloth from that wrapper and gave her, because obviously she doesn't have the money to buy pad every month. So the wrapper becomes an alternative. And she's tying it on her hand because the one on her hand is like a reserve, so that when the one she's already putting on gets soaked, she can easily untie the one on her hand and to support herself. So, but does that really help? But when we begin to tell these stories, it inspires action and advocacy. And compelling stories can motivate individuals and communities to take actions regarding menstrual health issues by highlighting the real-life consequences of period poverty and lack of access to hygiene products. Storytelling can galvanize support for advocacy efforts and policy changes. Now, moving forward, having looked at storytelling and why it is important we begin to tell stories and begin to connect, amongst one another, it is also important to look at media. Storytelling enough on its own is not enough. How do we bring this story? How do we tell this story? How do we make the world to hear us? And that is where the media comes in. Media arguably refers to various channels of communication used to disseminate information, news, entertainment, and education to the public. It includes traditional platforms like television, radio, newspaper, magazines, digital platforms such as social media, websites, streaming services, and of course, it is also an intermediary between a content creator and audience, and it shapes public opinion and perception and behavior. Now, when we look at the media, there is no gainsaying the importance of media in not just public health or menstrual health, but in driving change. A perfect example was 2020 COVID-19 pandemic. All of a sudden, the world was on a hold. Everything was shut down. And the only way we could communicate with one another is through the media. It was through the media we could know, social distancing is important. It's through the media we could know, this is just face masks, use sanitizer. No one was going to each other's house one after the other to educate us or to communicate this information. It was the media tools that were utilized. At that point in 2020, media became one of the most efficient tools, to reach out to humans and drive societal change. So the importance of media in public health and menstrual health. Media serves as a crucial source of information about menstrual health. It keeps individuals informed about hygiene practices, available products, and relevant health policies. It ensures that community stays updated on critical health issues that affect women and girls. Through the media, it's not just about, like our keynote speaker talked about, I think towards the end of his presentation, he says, I think it's time we focus more on what is important other than TikToking and dancing on TikTok and doing Facebook and dancing on Instagram. How are we supposed to utilize these tools? How are we supposed to utilize these media tools? Because almost everyone, at least 70% of youth out there have access to smartphones. How are we utilizing the content of these phones? How are we utilizing them to tell stories or to pass information that is relevant or that would drive social change? Because when we do this or when we begin to utilize this media, it has the power to recollect and shape cultural attitude towards menstruation. And also by portraying positive narratives and diverse experiences, it challenges stereotypes, it breaks cultural taboos, and it creates inclusive representation that validates the experience of women and girls. Now, storytelling through entertainment or entertainment through storytelling like the TV shows, social media, films like I do, and media, it can engage audience in conversation about menstrual health in a relatable way. It provides a platform for sharing personal stories that fosters connection and creates a supportive community around these topics. Why have I chosen to tell stories? Why have I chosen to tell health stories? As a historian, I went back in history to look at how public health challenges has been taken care of, what were the necessary tools, how were the people in the past, looking at from the colonial times, what were the tools that these colonial authorities utilized to drive social change in their colonies. And I realized how much role the media played, especially because what I'm currently researching on as a graduate student, I'm working on the bubonic plague of 1924 in Lagos. And this was a time where Africans, quote unquote, are regarded as barbaric, people who could neither read or write, and by 1924, Lagos has already been confronted with this disease and people were already dying. And for the authorities in place, they were looking for a potent means to reach out to people to communicate the importance of hygiene and sanitation, and also to tell people the direct effect or the direct causes of this disease. And it was at that point that media became important. They utilized the media to make films about bubonic plague, showing rats and how Africans live in different in slums and live in congested areas and all of that. And I'm not just telling this because I want to talk about my thesis. I'm telling it because I want us to see, at the end of this, the kind of changes that, that African societies witnessed after this, because people understood what is required of them. People began to see ways that they can actually, address these issues. And that's what media does to us. Because, when things are just written and you write it and you read it, you tend to forget, but when you watch things, it sinks deeper. It's just like when you're out there and you watch a film on maybe a civil war, and when you see people died and you see bloodshed, that kind of experience live with people, and they would want to do everything possible to make sure that such a thing doesn't occur, other than when you read it alone. So it is important, or it is high time we begin to use media alongside the text, writing text or books, to drive change in society. Now, moving ahead, the social media's power in breaking taboos. Social media, like I've already mentioned, we have YouTube, we have Facebook, Instagram, TikTok, and the rest of them, Twitter or the X media, which has over the years helped to drive changes. And thankfully enough, we have people like people we call influencers these days who now use their platform to drive changes. And in Africa or even across the world, women are taking charge of these influencing positions. They are the ones taking these platforms to to drive change. So how about we begin to use this media, or we begin to use this our influencing authority to positions to drive change, or to discuss what is more important or what is pressing as it regards to menstrual health. How about women begin to use media, to drive change? Not just women alone. I mean, men. How about we begin to utilize this media, and every day or every week we creating weekly content, because research are coming out, and as the keynote speaker would agree with me, as every time scientists are bringing out new research, how do we keep people updated? It is through the media. So it is time people begin to utilize these tools and to address social changes. And also, this is for me an opportunity for me to, this is a call for action. We must continue to engage media professionals, influencers, and community leaders to amplify the voices of those affected by menstrual health challenges. It's time to support creations of films, documentaries, social media campaigns that focuses on menstrual health, because it provides platform where girls and women can share their experiences openly. I have an initiative that is coming up very soon, which I call I Can Tell initiative. I Can Tell is you have a voice, tell your story. No matter what keeps you, what makes you different from me. We might have a similar experience, but what makes me different from you is that I know that my story is worth telling, and I'm telling it. So are you ready to tell your story? It is high time everyone understand the importance of storytelling and begin to tell your story, because everyone have a voice. There is nothing like the voiceless, except that some people have microphone. And which is why I Can Tell initiative is I am beginning to bring give people that platform to tell their story through media. Because the media, when we tell our stories and when we share our experiences, people would see that what we are going through, we are not alone. A lot of people are going through that, and that would help us to connect, find like minds, and also drive societal change. Moving forward, I am committed to using media. I'm committed to using films to create health awareness, not just for menstrual health, but health challenges as it confronts African society or the third world. So I would say that I'm very happy to have been in this dialogue. When Bluzo reached out to me, I was so excited to come here and share this experience. And I wouldn't stop, because she is also interested that I share my challenges, as a filmmaker. What does it mean to make a film about women as a man? And how did I come about, telling a story? I mean, there are so many stories to be told. Why menstruation? Why menstrual health? Well, I would say that it wasn't easy, but I think saying it wasn't easy is like a cliche, which we normally say, because nothing is actually easy. But I would say that as a guy, one of the challenges I encountered when I was making this film is when I said I want to make a film about menstruation, the first question is why you? Don't you think it's for women? Why a man? Do you think these girls will listen to you? Do you think they would be open to talk to you? But to my great surprise, girls were, I don't even say if I would say they were more comfortable talking to a guy than women. I don't know. Because I think some of them realized that, or they realize that it is time the other gender understand what they are going through. And then when they see the other gender, which quote and unquote marginalize them, sideline them, and push them to the back, is now coming to to tell their story and all of that, they were comfortable talking to me, because I am also working on a documentary where I am interviewing these girls and their challenges in rural communities, because a lot of them they go through a lot. They go through a lot as regards to menstruation. And in one of the stories I was driving in A Stain of Red, which is my film, is why are condoms given for free in hospitals, whereas menstrual pad or sanitary products are not given for free? I know, yes, it is to curtail STD, but then thinking about it again, sex is an option. You make a choice to have sex. Then to talk about whether you have unprotected sex or not, and then to spread STD. But menstruation is not an option. It is a natural occurrence. It must happen. So why are we prioritizing choice over natural phenomenon, or what is a compulsory? This is compulsory, about it's something that women cannot do without, at least for the first 30 or 45 years of their life. Why are condoms given for free? So that is what I'm also another angle I'm looking at it, calling on governments, private sectors, NGOs, it's time to look into this issue. Perhaps not to outrightly provide pad for free, but then how about subsidy? How do we subsidize the prices of sanitary products? How do we make it, at least easy for people to afford? Because in many parts of Africa, people don't even eat, people don't spend up to $1 a day in food because they don't have the money. So how do you now use that money to go and buy sanitary pad? And that is why you see many of them, they resort to using cloth, tissue, and using nylon. I met a young girl who told me that what she does is she collects newspapers. She collects a chunk of newspaper, she pieces it and wets it, and then it forms like a pad, like it becomes like a towel, and then she puts it there. And so things like that are unheard of. It's because it's not just about what's them finding alternatives, about the health risks involved. It's about the challenges, and it's about what kind of information, what kind of message are we trying to tell? Even mothers too. Even mothers, lots of mothers don't have the right information. They don't have the right knowledge because many of them still pass the same story or the same experience or the same story, just the way their mothers have told them. So how about the younger ones that are coming up who have access to at least the Western education and understand what is happening now? How are we telling these stories? How can we begin to change this narrative about menstruation, the stereotype, and how do we begin to drive this societal change? So making the film was an amazing experience for me. I had first-hand experience with young girls in Africa, in Nigeria, Southeast Nigeria, and they were comfortable to tell me their stories. And they are at the same time, they were telling me that, oh, look, we want our faces to be out there. We want people to see us, because it's no longer a shameful thing. It's not. They're not ashamed. They're not ashamed. They want to tell these stories because it's a burden to them. It's something that's, like someone said, I check how many times I'm going to menstruate, and then I know how many pads to get, or how to help myself and all of that. So the challenge, the effect is cumbersome already on these young girls, and they want to tell these stories. If it is men that is going to bring the solution, they don't even mind. If it is a woman, they don't even mind. What they want is solution, and not just a solution, but a long-lasting solution. So as a filmmaker, or as a media advocacy, and as a storytelling advocator, I am encouraging everyone to, for us to, utilize these media tools, to drive change in the society. And Extend of Friend is not just the end. It's not just the end, it's just the beginning of many other things I am out to do, not just in menstrual health, but in media. I am committed to using films to tell health stories not just for Africa, but in a global space. Thank you so much.
Thank you so much, Mr. Sochima. Thank you so much for that session. It was so profound. He talked about the importance of media, right? And if you all can agree with me, there is a way we can learn through images. I don't know, most of us that were in high school are still in high school. We know that we learned better with diagrams, with what we saw, right? It was easy to retain knowledge based off what we saw more than what we heard. So he talked about how it is important to use TikTok. Oh my God, emphasis on TikTok. The amount of young ladies on TikTok, if we can leverage TikTok to talk about menstruation, right, for upcoming mothers, because every single woman here is an upcoming mother. We're going to be mothers in future. We're going to talk about menstrual hygiene management to our various children, and it's going to be so important that we have this knowledge and we leverage media for the use of this. So this is so profound. This was exceptional. It's important for us to actually occupy. We need to get into the social media space, and we have to prioritize the message that we're giving out. We're not just going to go and talk about, menstruation, like Dr. Chidubem said earlier in the conference. He talked about how menstruation is not just about one person. it is about the community, because this involves our nation. This involves the economy of the nation. We're not going to go and say, okay, when you're on your period. No, we're going to talk about how this goes on a global scale, how this affects the mental well-being of one person, and how this can eventually go around the nation, how important this is. Why is condom free, for goodness sake, and pad is not accessible? Why do I have to go to the restroom and it's tissue that I'm seeing there? Because a lot of times you end up using tissue. Imagine you're out with, on a dinner with friends and you find out that you are bleeding. The next thing is to use tissue, which is not even hygienic, right? Because there's no sanitary pad. And if you ask, some people are even embarrassed. Like he said, a lot of ladies, is an embarrassing thing to go to the owner of the restaurant that you're at and say, please, is there a sanitary kit? You are shy because you feel like they'll be like, this one does not know when she's menstruating or what, because that's how a lot of us talk. But don't you know that is your cycle? Didn't you properly plan for it? Don't you know you're not meant to say it? It's just a whole cycle that we have to reorientate people on with social media. So I'm so glad that you said what you said today concerning media and the importance of leveraging media, and you talked about your movie, and there was a particular scene, I just have to recommend this, how she cut a part of her wrapper. And you talked about how you met ladies that were using newspapers instead of sanitary kits. And if we do further research, I'm sure the stories that we would hear would be, more alarming than this. And this is why we are here today. We are here to, brainstorm on solutions, right? Actionable solutions, things that we're going to start acting on today, because every single person here is a voice. It's not just the speakers. The speakers are showing us just how important this is. But we have to understand that if we come together and actively, be intentional about these points that they are talking about, we are going to have a different community. Look at COVID. He made mention of COVID. Mr. Sochima talked about how COVID, because of social media, everybody understood how dangerous it was. In fact, it was so bad that we began to have info pandemics. People were saying things that were not even true because of how viral that it had gone. So imagine if we do that for menstrual hygiene management. Just imagine how far we would go on this topic and how much we would enlighten the masses on why menstruation is so important. This is so profound. Thank you so much once again, Mr. Sochima. Thank you so much for this session. Thank you so much for your presentation. All right, guys, the next thing on the agenda is, if you have questions for Mr. Sochima, I'll just check the chat box. For those that have started dropping their questions, please, if you have questions, this is the time to ask your questions, right? So I'll just give us a few minutes to interact with the comment section, show your questions. I have 10 minutes, so I'll just wait a few seconds for people to type in their questions. Questions from Mr. Sochima, or we'll be moving on. All right. Dr. BJ is asking, do you have healthcare personnel helping? Do you have healthcare personnel that helps you edit the scripts? That is what he's asking. I think there's a typo. Do you have a healthcare personnel that helps you to edit the script of the movies that you make? Am I on track with that, Dr. Bridget?
Yeah. I think I also got the question. Yeah.
Thanks.
So he's asking if I have a healthcare personnel that helps me to edit the film, because that's that's very important. So for A Stain of Red, it was me doing like a litmus test. I wanted to know what this is going to be like. So what I did was I researched on what the story I wanted to tell. And when I had the scripts, I make sure that everything I had there is verifiable. So, but currently now I'm working with a team. I'm working with a team of researchers, medical practitioners, for many other stories we are to tell, because I'm not just telling factual, I'm not telling fictional stories, I'm telling factual stories. So, and at this stage is pertinent that I utilize people in the medical practitioner, because there is only so much I can do as a historian, as a researcher. So yes, moving forward, I am already working with medical practitioners who are also verifying and making research on the things we make or the films we produce, to make sure that every information we give out there is important. Because I think I will also use this to say that not just using media to pass information, but the right information, because also misinformation also comes from the media. So it's also important that as we utilize this tool, we should use it, for the right information, verifiable information and data, so we don't cause kind of tension or problem. Thank you. Hello, Beta, are you there? I can't hear you. Blessing
Yes, I'm here. I think something
Okay.
happened with Betta's network, so I'll just take over. I'm
Okay.
looking at the comments now, and you have a second question actually. So someone is asking, and first of all, I think Dr. Buje is asking, what's the name of your organization?
Okay, it's Lifeline Films Network. Lifeline Films Network. I have a website. I can just quickly type in the websites on the
Please do. And then
yes.
the second one is okay, I can't get the Zoom user's name. So please, every other person, if you're dropping like a question and your name is not there, right, you can just put your name. So the Zoom user is asking, how were you able to convince those ladies to open up about their menstrual struggles?
Well, for the young girls I interviewed for the next project I'm working on, because I'm actually working on a documentary at the moment. I'm compiling some data for documentary. First of all, I didn't go alone. I went with girls, to have this conversation with them. And like I said, I pointed out, to my greatest surprise, many of them they were welcoming. They wanted to talk. They wanted to tell me, what is going on, because I told them, I think, you don't know, maybe because I said I was from the United States, I don't know. So they were like, perhaps their story is going to go to the world, to go to the global space. They want people to hear it. And so I told them that, look, the film I'm making is not just for me to make film to entertain people. I'm not making entertainment film. I'm making intellectual films. So, and I told them, see, these films is going to be screened in US, in Canada, across the world. People are going to hear your stories. People are going to see your faces. People are going to, know what you're going through. They were okay. So I didn't go alone. I went with a researcher. I went with someone, which is a young girl, two of them actually, who were helping me to kind of do this interview, which was what I did in the last, the few moments I spent in Nigeria. But for the story for A Stain of Red, it was actually a real life story from someone. So I worked on that with my script writer, and we were able to have that done. Then for the cast, for the young girls, they were very interested. When we called the audition, when we announced the call of audition, it was amazing how many people that showed interest because they wanted to tell this story. We had to screen and screen because, of course, it's just a short movie, a short film, so we couldn't accommodate all of them. Just the audition flyer being out there in the space, people were already interested before I even started talking.
Mm. Okay, let me just round up so I can hand over to Betta. And you still have a question on when will it be available. I am also waiting to see when it will be available. Right.
So I'm waiting for the film to be licensed. I want it to be. I want the film to reach everyone, because the reason I made it is not for my self-consumption. I made it for people to watch, to see, to learn. So as soon as it is out, I'm going to be in touch with Bluzo Foundation, and I'm also going to make sure that through her, a lot of people is going to know about it. And once it is licensed, I'm trying to make sure it's licensed by a streaming platform, so people can just go there and watch it and share, it with one another. So as soon as that information is out, I'm going to put that in the space. Yeah.
Thank you so much. I will certainly let everybody know, so you don't have to worry. You get an email from us. That's why we were so intentional about having everyone to register. And I think Dr. Buje is still saying something. So he said the African Union Youth Envoy Office will work with you. So here you go, Sotima.
Thank you, Doc. Thank you.
Here
I'm
you
so I'm
go.
so honored. I'm so honored, Dr. Dubem. I'm so honored for this opportunity. And I'll just go right ahead to paste the website of my Yeah, so that people can also see what we do there, because we're also looking for collaborators, whether you have a story, you're a writer, you are whatever skill you have, it is very important, and it's very important for us to come together and tell these stories. Yes. Thank you, Dr. Dubeng.
Yes, so Dr. Buche, I can share his email. Am I allowed to share your email with Dr. Buche?
Sure, please go ahead. Of course you can.
Yeah. So after that, I'm just going to write it down as something I'm going to do. I will share the email. And then Beta, please, you can take over. Thank you.
Thank you so much, Blessing. Thank you so much. My network truncated for a bit. All right. Thank you, Sochima. So next on the agenda is our networking break. Okay, this is the time where we get to know each other. You could drop your social media handles so we can get to know you. Tell us about yourself, your name, your Instagram, because, Sochima emphasized the importance of using media, right? So this is step one. We have to know each other in order to build a community. So, drop your social media handles, and as you're dropping your social media handles, also check out, the profiles of other people, follow them, and, signify in the comment section that you have followed them, and also please, I'll need your videos to be on because I'm going to take a screenshot for the event, right? So please turn on your videos so we can take a screenshot, smile well, just, be happy and be excited because this is very exciting. A lot of solutions are going in, all right? So I'm going to take a quick screenshot. I hope everybody is ready. All right, videos have to be turned on. 3, 2, 1. Are we ready? Okay, go. All right, let me just take another one just in case. All right, so please, I've taken the screenshot. Thank you so much for turning on your videos. Please interact with the comment section. This is the time to know each other, right? And connect with one another because we want to make actionable solutions as a community. One person cannot do this. We are all leaders in different sectors. So it's good that we come together, all right? So only one person, okay, so it's only Sochima's link I'm saying in the comment section. Guys, we need your social media handles. We need to send our social media. Let me send mine. Please send your social media handles in the comment section below so that we can get to know each other. I'm going to wait a few minutes for that. And also, we are also going to acknowledge other organizations in the house. This is very, very important. If you are representing an organization, please let us know, what foundation you're representing, what exactly does your foundation do. We would very much like to know and interconnect with each other. So this is also the time for organizations that are in the meeting to tell us what they do and, their presence in the conference. So I'll give us a few minutes for that, just a few minutes. All right. I'm currently waiting for everyone. Okay, something has dropped. Okay, a lot of media handles are coming in. All right. Hi, Samson. Thank you for sending in your LinkedIn. Hi, Benedict. Thank you so much, Benedict. Thank you, Mohammed. Thank you so much. All right, this is the time to interact. Organizations in the house, we'd like to know you. If you're representing another organization and you're very intentional about menstruation hygiene, we'd like to know you and your organization for, possible partnerships in future so that we can, further expand this project. All right. I'll give us a few minutes to interact with the comment section. Welcome, Precious. Thank you so much for sending your social media handle. Thank you, everybody. Thank you. Thank you, Grace. Thank you so much, Grace. All right. So I'll give us a few seconds to make sure that we also interact with the links that other people have sent. This is the time to go and follow their social media handles so you don't forget. Very important, so you don't forget, so that you are actively working on it. All right, we have Mohammed Isa, and he is from the Futurize Initiative Nigeria. Thank you so much. Thank you for tuning in, Mohammed Isa. It's so nice to have you on here. You could also talk about, where you are from and what your initiative is all about in the comment section below. We have enough time for that. Thank you, Sochima, for dropping your LinkedIn. Thank you, John. Thank you, Segai. Please, I hope I got that right. All right. Okay. Wow. Okay, Dr. Chidubem is asking Mr. Sochima a question in the comment section about the African in December 2024. Okay. So I think Blessing will handle the message.
Yeah, I can see
Yeah,
that. I
sorry.
will certainly arrange that.
Sorry, Blessing. Yes, better, events like these are very good. The young man is doing very well. It's unfortunate that these are the people we should even be highlighting more. And it's often sad that the people doing the great work are never on the spotlight. So when you Google me, you just see, no. But these are the people we should be promoting because mental health is a big issue. So we just finished a meeting about a month ago, and we are having a diaspora youth summit. So as one of the coordinators under the office of the African Union Youth Envoy, Her Excellency Chindo Mbipa from Zimbabwe, she heads over 600 million young people between the age of 0 to 45, which is our own definition for youth. But of course, in the UN, it's from 0 to about 29, and then in Europe, maybe 35. So we have a youth summit that we are planning to have. And this, I prefer that the discussions we are having, on how we can add value and be different from our fathers, because obviously Sochima is different from his father, and he's putting himself in a light that people will never forget. His videos will become legend for him. He will leave his mind in those videos when he's long gone. So I feel that having us display his thriller, he understands what I mean. So there's a thriller section in the movie, then there's a big section in the movie. So I will advise him to have a little thriller. We can play that when the African Union Youth Summit is taking place in DC. He's currently in the US, which is good for us. You understand? We'll see what we can do to support, maybe give him accommodation. We may not be able to pay for everything, but ensure that at least it's not just about the Nigerian thing, or the story of a Nigerian child, that we can also connect him to Benin Republic so that they can transcribe this in Egypt. He needs to work with Dr. Nohan so that they can transcribe this in Arabic, because remember, she said something important. You compare apples to apples. That's when reality is clearer. You cannot be comparing us to America. Let's not go there. We're miles away. And then when you compare with America, it now looks like it's so difficult to do. It's impossible. It can never happen. And that's what our leaders always try to do. They say, hey, it's America. Oh, it's never. No, just tell them, look at Kenya. Look at Senegal. Senegal has, in the Maliki region, the city, the mayor there, they have absorbable pad from their fabric. The only thing is that there's a specification. It is labeled, it is sanctioned. Then they have an agency that verifies. Then it's packaged and it's sent. So I'm also reaching out to every one of you. The links will be out soon for those that have visas that can come to the US. It's a wonderful time. And I think this is one of the benefits of this kind of program. I will never have met Sochima if not for here. So I definitely feel that we can show his thriller to all the heads of states that will come, show his thriller to Africans like him that is in diaspora that can resonate and say, we can do a video of this screening in Senegal. I know a lady who will definitely do it in Congo. We'll work with him and say, can we write our scripts for Congo? And I love what he's doing. He's telling you, bring your own script. So his organization is also a platform that filters scripts and then ensure that the storyline is the same. Because you cannot be saying something different from what he has said in Nigeria with respect to menstrual health, and then now saying something different. It can create a lot of confusion. So I completely agree with him and advise him to even set up a special project. We're a platform that captures, health-based story. Don't limit yourself to menstrual health, because these are the strategies that are very important. There are many other health-related issues that people are going through. Breast cancer for more elderly women, hormonal imbalance, you understand, and psychological problems themselves, marriage-related things. Don't limit yourself Health is not just about the menstrual. Even reproductive health itself is a big deal. You understand, from beginning to the end, infertility, adopting children. These are ways we express the best versions of ourselves. But these are taboos or cultural things that people do not want to see. And people do funny things just because they want to have babies. Whereas there are solutions that are out there, educations that they need to know. So the program here, what Boluzo is doing is what we should be doing, bringing some of our smartest mind, articulating thoughts together, and helping one another. I'm not a script writer, but he knows what I'm saying. That makes sense. You understand? Just having a trailer, putting it on TikTok,
sure,
can already even tell you the story even before the final clip. But I can assure you that we will reach out to you. Her Excellency will reach out to you. We're very proud of you. This is what it should be. And we want you to work with French-speaking people. Please, I'll be sending to you some of our fine minds here. Work with people in diaspora here. We have to help our people, and better too. We have roles for you too. I hope you have a visa. If you don't, maybe we'll create a link for you. But it'd be nice. I love your moderation and everyone. And Hazan too. I also want us all to know that we also have people that share different faith-based principle with us, and we should also respect that. You understand? Allah, which is our representation for our Muslim brothers, always preach that we should be best versions of ourselves. Oh my goodness, I saw one of our leaders in diaspora here, Mary Apollo. Well done, my leader. Mary Apollo is from South Sudan, and she's one of our leaders. She's my boss here. So if you want the US State Department, you want an event, you want your issue to be brought to the global space, is here. Mary, I was just talking about Sochima. We need to help this young man. You understand? He's here with us in diaspora. South Sudan also has a lot of issues, as you know, and I know Mary has been funding a lot of projects. So we need to work with them and many other people. I'm hoping that this networking process will bring out more people. In short, I want more scripts for Northern Nigeria. I want more script for those in the Northern space. I want to see all our Northern sisters, all our Northern young men in these movies, because they also relate with pictures. Picture speaks 1,000 words. You're right, Sochi. So it's gather all this your thought together, share this your PowerPoint presentation, have a fire chat, Instagram fire chat on this before you launch. Yes, get 1 or 2 influencers to make this happen. Hopefully, when they see that you're going to premiere this at the December event, it could also help, trigger. I know that Nigeria has bureaucratic processes of licensing, and it's sad. This is the one you should not even have bureaucratic, because this is about people's life. But of course, our dramas is the things you prioritize are obviously different for all African stuff. So we must constantly support good ideas that put our young girls, put our women, put our aging women, put women with disability in a spotlight. So don't only do movies about just the abled women. Also do that this intersectionality is even worse for them. If it's already bad for someone that has 2 hands and 2 legs, is equally demonic for the person that cannot see, the person that cannot hear, the person that is on wheelchair. No, it's the truth. So, and that's what Dr. Nora is saying. We keep on excluding considerable percentage of people, and we do not have variation. In short, your next script should be variation on stain part 2. You understand? Because somebody can have one flow for 2 days, somebody can have for 4 days, someone can have for 5 days. Yeah. The realities are different, the outputs are different. So, but when you are producing products that are only solely for certain things, it makes it very hard. See, this is why we need to talk. Smart people need to just sit down and begin to articulate things together and help you have ideas. You already have a business empire already and scripts that are waiting to happen. So we just need to know how to leverage, like you said, innovation, technology, like Beta always says, we need to work together. You need to work with women, driving women to have you need to even train a woman to also be a script producer yourself. See, that's the way we can help. Then you sit back and then you watch and build an empire. Only you cannot cover 55 African countries. It doesn't make sense. Even there are some African countries you cannot even film. You will need a woman to film. So you also have to also be looking at those futuristic stuff. Thank you. I just wanted to share this so it doesn't get lost in the in the
Thank you.
meeting. Thank you. Good event.
Thank you. I'll keep in touch. Thank you so much. I'll definitely keep in touch. Thank you. Thank you. That's a very insightful comment and feedback. You have also opened my eyes to many other things, and I'm very, very happy that I am one of the speakers in this conference and dialogue. And Pluso, I can't thank you enough, but I know and I believe that this is just the beginning to many things that we're going to do together. I know we're just getting started, and the sky will definitely be our starting point. Thank you, Beta. Thank you.
I just want to come in a little bit before we move on. Like, I am so excited for Sochima because apart from him being a guy, I have never seen really actually thought about the storytelling aspect of menstrual health advocacy because sometimes we go to schools, Better you can bear me witness, we don't even have enough time like to get all the students to sit down and listen to us give a long talk. But when you have a short movie like Sochima's movie, I feel like it's going to make it so easy for many menstrual health advocates because all we need to do is just gather a few girls, sit them down, and play Sochima's short movie. So it is such a blessing to the African continent because it's coming from the African perspective, right? Chimamanda Ngozi Adichie will say something that we don't see a lot of Africans telling African stories from an African perspective. And this is what I love about his movie. Thank you so much, Sochima.
Thank you. Thank you. You're welcome. Okay.
Thank you. Thank you so much. Thank you, Sochima. Thank you, Dr. Chidubem, and thank you, Blessing. Okay, so somebody is suggesting something. Tino Ade is suggesting that we have a movie date with the girls. We movie like this. We movies like this. This actually, yes, we should. And we use the hashtag menstrual hygiene. Very, very important. All right, so guys, I hope you have interacted with people's social media handles. I hope you have followed a few people today because Dr. Chidubem said, and a lot of other speakers have said, it is important we build a community of change makers, right? And to do that, we need to network. So you have to go, and it's not just to drop social media handles, you actually have to follow them. You have to make sure that, hi, I'm from the Trans-African Dialogue, and it was so nice to have you on there. It's not just connecting now, we have to communicate, because I've noticed that LinkedIn is just a place of connect, and that's all. We actually have to be intentional about communicating with these people. So send a DM to whoever you've connected with that has dropped their social media handle.